by devices. The smartphone are using to detect ECG and also ultrasonography at home. Near future, we may see high-power microscopes with the smartphones. For example, analyzing swab samples, sensors could pick up abnormalities in DNA or detect antibodies and specific proteins. An electronic nose, an ultrasonic probe, or almost anything we have now could be yoked to a smartphone and augment its features. And we have to get ready for it. Then robot staff hospital. The robot staff of hospital can be used as cleaner, patient care attendant, lifting of unconscious patient, carry of patient in UV disinfectant room. The robot staffs do not need sleep, do not take food. This can be helpful during any epidemic or pandemic situation also. It can do some monotonous work for 1,000 times, such as hospital disinfection. Nowadays, robot-assisted surgeries are going on in advanced country. Near future, artificial intelligence or AI-based program and protocol will make the robot to perform surgeries individually without surgeon. With the help of 5G network, it is possible to do robotic surgery as a surgeon from remote location. Real-time 3D holographic image of body parts. Real-time image or real-time 3D holographic image of the body parts can be made and can be used by doctors to detect the problematic area and can analyze it layer by layer and can make the treatment plan very easily. The robotic prosthesis with sensors which are incorporated in human brain, so the prosthesis can move precisely as per need. The robotic exoskeleton helps the paralyzed patient to walk. So now, nanoparticles and nano devices. Nanoparticle and nano devices will soon operate as precise drug delivery system or cancer treatment tools or teeny surgeons. Microboards designed to literally swim through our body fluids. Small, smart pills like the PillCam are already in use for colon exams in a non-invasive, patient-friendly way. Small part pills, an electronic pill that can be controlled wirelessly and really or relay diagnostic information or release drugs in response to the smartphone commands. So 3D printing. 3D printing can bring wonders in all aspects of healthcare. We can now print biotissues, artificial limbs, peels, blood vessels, skin, heart, lung, and list goes on and will likely keep on doing so. By using stem cells and tissue engineering, the organs of any specific human can be made as per template of the organ produced by 3D bioprinting process. Very soon, this technology could allow your doctor to print you a new organ on demand. Bioprinting is slowly becoming more and more feasible. In November 2019, researchers at the Rensselaer Polytechnic Institute in Troy, New York, developed a method to 3D bioprint living skin along with blood vessels. This development proves crucial for skin graft for burn victims. So, could bioprint be the future of organ transplants? ultimate question, could 3D bioprinting organs be the key to immortality of the human? Thank you to all of you. Thanks.
Thank you, Dr. Arif. Dear audience, thank you for your attention and patience hearing. Hope this will help you to broaden your knowledge. We are waiting for our chief guest's arrival. Thank you.
Chief guest,
Minister, Mr. Saifuzzaman Chaudhary, Ministry of Land, Government of People's Republic of Bangladesh, is between us.
Now we are going to start inaugural function of Apollo Imperial Hospitals. Now we are going to start inaugural function of Apollo Imperial Hospitals. In this program, our chief guest is Honorable Minister Mr. Saifuzzaman Chaudhary, MP, Ministry of Land, Government of the People's Republic of Bangladesh. And the guests of honor are Mr. Dinesh Madhavan, President Group Oncology and International, and Mr. Devisan, CEO, Partner Hospitals.
Now, the board member of Apollo Imperial Hospitals and chairman of Chittagong Eye Infirmary and Training Complex Trust, Mr. M.A. Malik, is going to chair the function, and we are requesting him to come to the stage and take seat along with our chief guest, Mr. Saifuzzaman Chaudhary, MP.
We are also requesting the founder chairman of Apollo Imperial Hospitals, Professor Dr. Rabiul Hussain, to accompany our guests of honor, Mr. Dinesh Madhavan and Mr. Devisan, to come to the stage and take their seats.
We also request Mr. Amjadul Feddos Chaudhary, the Managing Director of the Board of Imperial Hospital, to take seat on the dais.
We begin our main program with the recitation from Holy Quran by Dr. Faisal Ahmed, Senior Consultant of Pediatric Department.
the privilege to welcome all the honorable audience with the verse of Quran, chapter 26, verse 80, Surah Ash-Shu'ara. Allah says, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينِ. And He is Allah who cure me when I am ill. For the protection of human life against all sorts of diseases, germs, and the poisons, Allah has created such antidote that they have not yet fully encompassed by the human knowledge. If this natural arrangement have not been made, even a thorn prick could have proved fatal. In the Sahih Hadith, Abu Dawud, the messenger of Allah, peace be upon him, says, Allah has sent down the both diseases and the cure, and He appointed a cure for every disease. So treat yourself medically, but use nothing unlawfully. The messenger of Allah, peace be upon him, emphasizes that there is legitimate and halal cure for every diseases. We should not say there is no cure of this disease or that disease. It is possible that humanity has not developed a method of treatment or has not found a cure for certain disease yet. So we should believe in Allah and we should pray to Him. May Allah help us with the knowledge of the medicine to treat the human being. Ameen. Assalamu alaikum.
Thank you, Dr. Faisal. Now, our guests on the stage are going to be welcomed with flower bouquet by our students of Imperial College of Nursing.
We have amongst us a number of our guests and well-wishers from India and Bangladesh. We would request our students from Imperial College of Nursing to formally welcome them with the flower bouquet. The guests are requested to stand. They are Mr. Das Gupta, CEO, Apollo Hospitals, Kolkata Apollo and Eastern Region. Mr. Abhijit Majumdar, Chief Operating Officer, Apollo Hospitals. Mrs. Benazir Shroff. Mr. S. Ram Murthy. Shri Dr. Rajiv Ranjan, Assistant High Commissioner of India in Chattogram. Mr. Abul Momin, the journalist, writer, and columnist. Mr. Mahbubul Alam, the President of Chamber of Commerce and Industry. Mr. Ali Hossain Akbar Ali, Chairman, BSRM. Brigadier General Dr. Shamim Ahsan, Director, Chittagong Medical College. Mr. Nadir Khan, Founder and Managing Director, Pedrolo NK Limited. Mr. Mohammad Zahirul Alam Dubash, Chairman, CDA. Dr. Munir Ahmed, Country Director, Orbis International. National Professor Alamgir Mohammad Sirajuddin. Professor Muhammad Sikandar Hayat Khan, VC, East Delta University. We also request our students to give flower bouquet to Mrs. Kamrun Malik, former President, Lions Club.
Ladies and gentlemen, we are going to the main program. To start with, I would request Professor Dr. Rubil Hussain Sir, the founder chairman of Imperial Hospital, to kindly give address of welcome.
Good morning, ladies and gentlemen. I have great pleasure to welcome you all at this function, which is to mark the occasion of collaboration between Apollo Hospital Group and Imperial Hospital. At the very outset, we sadly remember the demise of our board member, one of the board member, Mr. P.R. Singh. Singh died due to COVID-19 last year. He was a dedicated social worker, and we are sorry to lose him. We pray for the salvation of the departed soul. We are very happy to welcome our chief guest of the function, Mr. Saifuzzaman Chaudhary, Member of Parliament, and illustrious son of Chittagong, at present the Honorable Minister of Land. During his tenure in office, he has made a number of revolutionary reforms in the land sector of this country. We recall with gratitude the support provided by his father, late Mr. Akhtaruজ্জামান Chaudhary Babu, at the initial stage of the Imperial Hospital. Actually, when I approached to him, myself and Mr. Malik, I told that you must do something for Chittagong healthcare. At that time, he was the chairman of the Imperial board. He started, he first told us that, he discussed this in the board. I told that you are a politician, I'm a social worker. I'm in business. So you must to get it done, not discussing. So he did it. I have also great pleasure to welcome another promising leader. He is, I think, late, on the way. He is in another meeting. He is Mr. Barrister Mohiwal Chaudhary, Honorable Deputy Minister. We are waiting for him. He will be any time he will be here. We also have amongst us our guest of honors of today's function. Is Mr. Dinesh Madhavan, President of the Group Oncology and International Hospitals, and Mr. Davidson, CEO, Partner Hospitals. He looks after many hospitals, and I believe he will be also responsible for this center. The founder and chairman of Imperial Hospital Group, Dr. Pratap C. Reddy, could not be present physically because of his health concerns. He is now 91, but is still very active. But he will be joining us in the online. He will deliver his speech. He will address you. But he has already joined in the program. I think, he has already joined. Has he? I welcome the chairman of Apollo Hospital and the board members and other Apollo Hospital Group who are joining us in this program. I believe they want to visit online. They have informed all their hospitals around the globe. They have, I think, 70 plus hospitals. So I think, all these hospitals, they have joined this program online. I also have great pleasure to welcome some of our very important dignitaries representing various stratas of the society and professions to join us in this function, which indicates their interest and eagerness to promote an international standard healthcare service at Chittagong. We have also amongst us a number of guests from India, guests and I would say volunteers, India, representing Apollo Hospital groups and other organizations. They have traveled all the way in spite of their very busy schedules to join this program. And their presence is a source of inspiration for us. I thank them and welcome them. I also welcome various media representatives who have been always very supportive to our activities. I welcome them in this program. Though Chittagong being the second largest city with the facility of biggest international seaport of the country, handling almost more than 90% of the import and export of the country, is lagging behind, unfortunately, in many important sectors, particularly the health sector. And when it comes to health sector, I would say tertiary healthcare, the referral services, lack of which many patients are compelled to travel abroad to seek treatment at the cost of many mental trauma. It's not easy for a sick person to travel abroad. And as a patient also, I know how difficult it is, how expensive it is, how time-consuming this is. And Imperial Hospital and Apollo Hospital in future, we shall try to give some relief to some of the patients. Of course, we need a lot of support from the government. We need a lot of support from all the strata of people. The Chittagong Eye Hospital Trust, along with some social workers of Chittagong, have taken initiative to set up this 400-bed multidisciplinary healthcare center. Imperial Hospital with the financial support from World Bank, and this is the first healthcare private level service the World Bank have joined us. I remember when they called me in the office along with Mr. Malaik and our MD, they told that Chittagong healthcare service is very poor. All the healthcares are in Dhaka, whatever it is. And second thing I remember, they told, in this project, there is an element of nurses training center, which is very important, and allied health also. And they also told that in our project, 10% of our beds shall be dedicated to indigenous patients, means patients who cannot afford to pay. This will be taking the lead. The promoters decided to make this healthcare institution to be the leading institution of the country, starting from its design to its completion and equipment. We are happy that this has been achieved, and till today, this is the best designed equipped hospital in the country. Unfortunately, excuse me, the facilities are not fully being utilized because of many barriers, which I am not going to elaborate. We are very happy to have a collaborating, supporting healthcare partner like Apollo Hospital Group. who have a long experience of 40 years in healthcare delivery, not only in India but also around the globe. A short video soon will give you more details about their activities. The main areas of collaboration are operation and management. 2. Human resource development. This is something Bangladesh is very much lacking in the health sector. Technology transfer, including providing clinical support. Due to some regulatory constraints, clinical support is not always feasible or possible. But the Imperial Apollo Hospital is going to make the best use of modern IT system, that is telemedicine, to its maximum. In the diagnosis, in the treatment, and also follow patients. And in the delivery of clinical service. This telemedicine is being practiced, I have seen in India and all over the globe, which actually very effective for providing clinical service, manpower training, technology transfer, and this is also cost effective in the long run. So together, we have decided to use the maximum. We are looking forward for a new era of development to provide better service to the patients of this country. Before I conclude, I would like to thank heartily to everyone present, and your presence is a source of inspiration for all of us. God bless you all. Thank you. আমি বলবো ওখান থেকে বলবো
Thank you, sir. As the founder and chairman of Apollo Hospitals Limited, widely acknowledged as the architect of modern Indian healthcare, Dr. Pratap C. Reddy could not be present physically in this program due to his health concern. He has joined us virtually. We would request him to kindly give valuable speech.
He is ready. Dear audience, the chairman of the Apollo Hospital Group, Mr. Dr. Pratap Chandra Reddy, as I mentioned that due to his old age, he is 91, he could not be present physically. Now he is going to join us and deliver his short speech. So we look forward to hear him.
Namaskar. Ivam Aporna, my dear members of the Apollo Imperial Hospital family, our guest of honor, Honorable Minister Saifuddin Chowdhury Karu, and our special guest barrister Mohammed Chowdhury, Abdul Momen, Muhammad Alam, and the most important, the person whom we all revere today, Dr. Professor Rabir Hussain, who has created an eye health care hospital, the first of its kind in this region, serving a large number of population. So I admire the great work that he has done. And also, along with the World Bank, have created Imperial Hospital with excellent infrastructure. Today, we are all pleased, dear members, and the various guests from the fraternity and the special guests who have arrived today. For all of them, I assure that Apollo Imperial Hospital, which you are inaugurating today, is going to make a significant impact. Because the concept of creating Imperial Hospital was created by Professor Hussain way back. And for the first time, the World Bank has funded this project. It has got excellent infrastructure. What we at Apollo, 4 decades ago, I thought that Indians and then the people in the region should get the same level of healthcare as the best centers anywhere in the world. It was not easy, but I'm happy with the great efforts that 100,000 plus Apollo family members, the doctors, the nurses, the supporting staff have created an outstanding institution, which is not only one of the best hospitals in the country, even in the world, because of the work that has gone in, the service excellence that they have brought in, the care and compassion with the service which is begun. This is what will bring the Imperial Hospital, which has excellent infrastructure. What we need to do is to add the service excellence to it, bring technology and digitization to make it as one of the modern hospitals which could get connected with any good hospital, good place anywhere in the world, so that people not just from Bangladesh, the people around the world will start will have a facility of par excellence in Chittagong. I wish all these members the very best of health in our efforts. Apollo will be there throughout this journey to give this complete awareness. We must all remember, we had this, the COVID pandemic, which the healthcare crisis, which we have not seen in the last 100 years. But the way the government, the healthcare people, I think we have admiration for the great work that they have done. But we have another great big threat. IMF has warned way back in 2015, saying that the world will face during this decade non-communicable diseases. What are these? The heart attacks, the strokes, the cancer, diabetes, infections, and overweight and mental illness. These, I think, are going to be the big challenge for this decade. 80% of the deaths is predicted to be due to a non-communicable disease. And the cost burden for the world is $30 trillion, and for India it's $4 trillion. I'm sure for Bangladesh it's going to be over $1 trillion. Can we afford this? Even if we can afford, can the families afford this? This is where I think Apollo has created a mantra to heal, to prevent, to predict, through Apollo Pro Health. The first health checkup in the world was done with my guidance 50 years ago. Today, Apollo Pro Health is the key to find out the state of health of an individual and also predict the illness so that cancers can be detected early and curable. Heart attacks can be prevented, stroke can be prevented, diabetes can be controlled, and overweight and mental illness and all of this. This is where I think Apollo Clinical Fraternity will interact with Apollo Imperial Hospital to make it as a state-of-the-art hospital, not just for Bangladesh. For the region, it should be one of the best hospitals. And I am sure with the infrastructure already present, with the clinical support which will be with them throughout, our doctors, our nurses, our managers, and our systems will make it, and most importantly, the digitization and teleconnectivity, artificial intelligence, all of these will make the hospital, Apollo Imperial, as one of the finest hospitals anywhere in the world. All that I want to assure is that this hospital, our goal is to be able to bring for the patients to get the best care at the right place at the right time. And this is what I promise from Apollo Imperial Hospital, that together we will strive to deliver this. Again, my heartiest congratulations for the entire family of Apollo Imperial Hospital for this day, and which we will remember as we remember 1983 when Apollo was inaugurated, and today where we are in the world of healthcare, I'm sure Apollo Imperial Hospital, with the cooperative efforts of all of us, will make this a hospital of par excellence. God bless you all. I love you all.
Thank you, Chairman. Veera Karasa.
Thank you for your illuminating speech. At this moment,
Thank you very much, Dr. Reddy, for your illuminating speech. And on behalf of the audience, I want to inform you, they thank you on the behalf of the Imperial Hospital for your illuminating speech. And your speech is a real hope for the Bangladeshi patients. I'm sure with this collaboration, we will be able to provide better service to the people of this country. May God bless you. Thank you very much. I would like to invite Dr. Pitha, isn't it? Pitha Reddy, who is the co-chairman of the group, to make a speech, short speech. Thank you, please.
Camera. Namaskar. Yeah. Namaskar and Shubho Aparna. I would really like to congratulate the Honorable Chairman for building such a facility of excellence. Is it audible? Is it all right? We have been hearing from our team members who have told us that they're totally fascinated with the kind of facility which has been created. And for us to partner in this great venture, I think is an honor. I'd like to say that to the Honorable Minister who is there, and to all the dignitaries who are part of this event and this function, that Apollo as a group stands totally committed to the people of Bangladesh. We have treated close to 1 million patients who have come to us over the years to our multiple facilities, whether it's in the area of cancer care, cardiac care, orthopedics, genetic medicine. I think we have worked together to see if we can make a difference in people's lives. And the people of that region are very close to our heart, because we know that every day when we come into the hospitals, we meet at least about 20 or 30 patients in every location practically, who come from all the way from Bangladesh. So for us, it is like a step bringing us closer to the population, that if we can work together in your facility and try and bring whatever we have learned in the healthcare space to your fantastic infrastructure which you have created with so much of passion, I think it will be a great partnership, and it's a winning partnership. I would also like to commit to the chairman, to the honorable minister, to all the other dignitaries in the gathering, that Apollo works hard to see how can we better any of our clinical protocols, how can we better the way we deliver service. Can we adopt digitization so that it is quicker, faster, and more focused? Can we take the level of care, not just keep it within the hospital infrastructure, but take it to people's homes, take it to people's hands? And in each one of these aspects, we have teams working very hard, teams focusing on what we can do. As we speak, we're collaborating with some of the best centers in the United Kingdom and in the US. In fact, Chairman just stepped out because we've got our collaborators from Italy coming here to see how we can work in the area of rehabilitation, wellness, and better lives for people. So this is an everyday thing with us. And if we can bring all the gathering and all this learning together and offer it to the people of Bangladesh in this beautiful hospital in Chittagong, I think it will be a very exciting journey. Honorable Chairman, I would like to say that, thank you for choosing Apollo to partner with you. And I would like to say on behalf of the entire Apollo team that whatever we can to make this partnership successful, whatever we can do to bring better healthcare to the people of the region, whatever we can to set the Apollo Imperial Hospital on the global map, we stand committed to it. Our teams will work 24/7 to do that. And I'm hoping and God willing that we will have a wonderful partnership and be able to provide the best in class healthcare for the people of that region. Thank you and namaskar and congratulations for building this amazing facility.
Thank you very much, Dr. Pritha. Actually, we have been expecting you physically in this program. I know you have some family programs coinciding with this program. So we look forward for your future visit as early as possible. Thank you very much. Next.
Thank you, sir. Apollo Hospital Group has long history of 40 years of service in delivering healthcare and health-related services all over the India and beyond. 3 short videos will be played which will give the audience an idea of their achievements in this field. Dr. Nasim from Apollo Hospital shall make a short video presentation. Thank you.
Honorable Chief Guest, Honorable Special Guest of the occasion, Guest of Honors, dignitaries from here and abroad visiting here, His Excellency High Commissioner Dr. Rajiv Ranjan ji, ladies and gentlemen of the audience, staff and students of IHL. Today is a momentous occasion. We are launching the joining of an iconic institution in Bangladesh with a global healthcare leader. We all know about Apollo Hospitals, about the pedigree which Apollo Hospital brings to the sphere of healthcare. Apollo Hospitals has a reach of about 140 countries, touching billions of lives. And this is what was the vision. Here I would like to also thank our founder and chairman, Shri Dr. Pratap C. Reddy, Madam Preeta Reddy, Executive Vice Chairperson, for guiding us today in this occasion in leading the light of this partnership so that the cutting edge technology, the excellence of healthcare is being brought to the doorsteps in Chittagong. That is the vision which Apollo Hospitals has brought in to Chittagong, the best of the best of healthcare, which is available in the rest parts of the world, are available now in Chittagong. And with this, I congratulate the population of the country. I congratulate the healthcare seekers in Chittagong that today I stand here before you where we share this celebration of Apollo Hospitals and IHL joining together. Thank you, sir. Thank you, IHL Chairman, sir, Dr. Rabil Hussain, for this vision. Without you, we could not have seen this great, grand institution. Thank you so much. A few videos, a series of videos which will do the talking for Apollo. Thanks a lot.
मुझे और बंसरी को ट्रैवल करना बहुत पसंद है. In fact, it was our yearning for wanderlust that brought us together. The day I held her hand, I knew यही मेरी soulmate है. The first promise we made was हम हर सफर में एक दूसरे का साथ देंगे. पर जिंदगी अचानक रुक सी गई. And life seemed to have different plans for us. I was detected with a very rare brain tumor. एक पल के लिए लगा जैसे life will not be the same again. पर बंसरी ने हार नहीं मानी. She was determined we win over this together. That's when we discovered Apollo Proton Cancer Center. Proton beam therapy से कुछ ही दिनों में I started feeling the difference. Now I'm leading life to the fullest with my soulmate. Thanks to this technology. आज मेरे पास उसके लिए एक सरप्राइज है. To renew our wanderlust and walk with her once again, hand in hand.
मुझे म्यूजिक से बहुत प्यार है. ऑल थैंक्स टू माय अम्मा. बचपन से मुझे याद है वो हर टाइम गुनगुनाती रहती थी. और उनमें से एक ट्यून हैज बिकम माय हैप्पी प्लेस. इट वाज अ डिफिकल्ट टाइम फॉर हर. जब मैं छोटी थी मुझे थैलेसीमिया था. बिटवीन हॉस्पिटल राउंड्स एंड ब्लड ट्रांसफ्यूजन्स Amma used to hum this tune. पंखों पे सवार मेरी परी है, भोली भाली. उनका एक हाथ मुझे सुलाने में और दूसरा मेरे लिए ट्रीटमेंट्स ढूंढने में बिजी रहता था. But she never stopped humming. She always wanted the best for me. She kept researching my condition. और उसी रिसर्च से हमें अपोलो कैंसर सेंटर मिला. अपोलो के डॉक्टर्स ने बोन मैरो ट्रांसप्लांट सजेस्ट किया. द प्रोसीजर वाज अ सक्सेस. आज मैं थैलेसीमिया फ्री हूँ. सालों से व्हाट यूज्ड टू बी माय हैप्पी प्लेस टुडे इज आवर हैप्पी प्लेस. आज मेरे पास उनके लिए एक सरप्राइज है. हैप्पी बर्थडे अम्मा. पंखों पे सवार मेरी परी है, भोली भाली सी मासूम बड़ी है, सपने बुनने की जो बात करी है.
Thank you. Dear audience, in a functioning hospital, it is not possible to make a public visit to some of the restricted facilities of this hospital for infection control. Hence, a short video is sharing with our guests to give an idea of the existing facilities of Imperial Hospital, presently Apollo Imperial Hospital.
Thank you. Ladies and gentlemen, our special guest, Honorable Deputy Minister, Ministry of Education of Bangladesh, Barrister Mohibul Hassan Chaudhry Nofil, MP, has arrived. We are delighted to have him among us. Now we are requesting our student to come to the dais and give him flower bouquet. Now we are requesting Mr. Abul Momen, famous journalist, writer, columnist, and recipient of Ekushi Podok, to say a few words in this occasion. Thank you.
President of the event, Honorable Chief Guest, the Land Minister, and Honorable Guest, Deputy Education Minister of People's Republic of Bangladesh, the guests from Apollo Groups India, and our very known person, the man behind all this initiative, Professor Rabiul Hussain. My respect and best wishes to them, and ladies and gentlemen. Well, as a citizen, what we can say, we can wish a very grand success of the initiative taken today, that Apollo Imperial Hospital from today will start giving service to the people of Chittagong. We all know that change is inevitable for both human being and the surroundings we live in. We see changes in the nature, changes in human life as well. So today, I'm a fit person, I'm a healthy person, but tomorrow I may not be so. We need assistance from medical practitioners, doctors. And we know that medical science is going through revolutionary changes with the advancement of science and technology. Technology has been used in medicine, in treatment, from long ago, but nowadays it is more regularly used for better treatment. And through Apollo Imperial, we would expect that we shall have a world-class medical facilities at our door. And we can trust it, believe it, that we will get it, because we know the persons who are behind it in Chittagong has the capacity to do it so. And also we believe that the Apollo Group, who has a vast experience of running hospitals, medical facilities all over the world, will also make it success. I would say only two more things, that a foreign journalist told me once when he visited Chittagong that your city is unique. I have visited many areas, many regions of the world, but never seen a city so rich in natural beauty. You have a sea on the west, a river flowing by the side of the city, a lake which is adjacent to this hospital, hills inside the city, and forest in the vicinity. 5 elements of nature are here. This is rare, this is unique. And it is called, that Chittagong is called Beauty Queen of the East. So we Chittagonians and the people who are managing the whole things in the country must also care for the nature of Chittagong, the landscape of Chittagong, the terrain of Chittagong, so that we can keep its beauty intact. Secondly, in this region, Chittagong is the most ancient city. Dhaka, the capital, is 400 plus years old. Kolkata is 3¼ century old. But Chittagong has a record of 1.5 million years history. Continuous city for 1.5 millennium. 1,500 বছরের ইতিহাস. It was a theater of many conflicts and confluence. The Arabs came here long before the Islam came into known. We came to know about Islam. The Muslims, before the Muslims, the Arabs visited Chittagong, had their locality even in Chittagong. So in this city, we see a fusion of many culture, many religion, many races, many people. So this is a special city. The Apollo group, people who are coming from India, I would say that you have selected the right place for your venture in Bangladesh, and I hope that this hospital will give us the world-class treatment that we needed. And as the chairman of Apollo Group said, that you have to have care and compassion, because it is not the disease we are treating, it is the disease of a patient we are treating. So here patient, the person, the human being is most important. And when a person is sick, needs care and compassion, which people say that helps him recover quickly and properly. So I hope that with a human face, with a compassionate treatment, this Apollo Imperial Hospital in Chittagong will soon win the heart of the people, and gradually we'll see that that the people from Chittagong are not now thinking about going abroad for treatment. We'll have our treatment within the city in our own doorstep. Thank you all. Thank you.
Thank you, Mr. Momin. Now we are requesting Mr. Mahbubul Alam, an entrepreneur, social worker, and at present the President, Chittagong Chamber of Commerce and Industries, to share his feelings.
Thank you very much. Today's President, Mr. M.A. Malik, and today's Chief Guest, Mr. Saifuzzaman Chaudhry, Land Minister of Bangladesh, who reformed the Land Ministry in various ways. I congratulate him as a President of Chittagong Chamber, and he was the former President of Chittagong Chamber. I think from me and the business community of Chittagong and the peoples of Chittagong to recognize him as he changed the various laws of the land ministry. Please give him a big hand. Today's special guest, Mr. Mohibul Hassan Chaudhry, Novel, and very good entrepreneurs who come from India, especially the Apollo teams, and who is the main key person of this hospital, who started his journey from the eye hospital and completed this one in Chittagong, biggest hospital in Chittagong. He's my relatives. So I congratulate him from me and my family and from the Chittagong business community. In presence of here all dignitaries of Chittagong, especially my honorable teacher, who is the national hero of the country, is a professor of national, Dr. Sirajuddin, Dr. Sirajuddin Mohammad Chaudhry, and other External High Commissioner of India also here, Dr. Rajiv Ranjan. Actually, Mahatma Gandhi tells one thing, Chittagong to the fort, Chittagong Sarvagre. This is reality. Who is Chittagong thinks today, the other parts of the country thinks tomorrow. I think in COVID situation, when we passed 2 years, but Imperial, Evercare are here. But small medical hospitals, Chittagong medical hospitals, and the peoples of Chittagong gone there. And really, in that time, these hospitals also served the Chittagong peoples. This is a great achievement for this Imperial Hospital also. It is also done by Dr. Rabiul Hussain. I congratulate him again. But one thing, this building is a world-class building, and all are world-class. But one thing is very important, that is nursing, doctors, and hospitality. I think today Apollo Hospital is merged with the Imperial Hospital. Definitely, the peoples of Chittagong, almost 2.5 million people of Chittagong, Coxbazar to Feni, these peoples are gathered in here in next time, and definitely they will really, the hospital will really serve these peoples. I hope almost every year, 1.9 million people gone to only India and other parts of the country also. But now Apollo is in Chittagong. So Apollo is very popular in Bangladesh. Maximum people of Chittagong, they visit Apollo in Calcutta, and Calcutta doctors are here. I hope with the collaboration of the Chittagong Imperial and with the collaboration of the Apollo Hospital, the people of Chittagong will find their physical treatment. So thank you again, Dr. I forget his name, Rabiul Hussain and his family. Definitely they will do something better and better for the Chittagong. Hopefully we will be the patient of this hospital and we will find our treatment. Thank you again to do something for me.
Thank you, sir. Now we are requesting our guests of honor, Mr. Dinesh Madhavan, to say a few words.
Namaste, Honorable Minister for Land, Chaudhry, Honorable Deputy Minister for Education, Dr. Hussain, other dignitaries on the dais, and members of this August gathering. It's a privilege for us to be partnering again in Bangladesh. Our story of providing access to excellence in care started when we set up the first project 2 decades back in Dhaka, when hardly anything was available and the citizens of Bangladesh were traveling to other countries for treatment. Today, Dhaka sees a remarkable change in the way the healthcare spectrum and the topography has changed because we took that early step. And when you see the Apollo Imperial put, which is close to your heart, I can only remember what the Mahatma says on the right there. Service is not possible unless it's with love. And that's the reason we are here. And I'd like to thank Dr. Hussain for reposing the faith with us for his project in Chittagong. It's a remarkable hospital. We see a lot of Bangladeshis traveling back in India because they believe in the doctors and the excellence that Apollo provides. And the intent and objective of this partnership is to make sure that you stay back closer to your loved ones, closer back home, so that same service can be provided here. And that's only possible if there's an environment and an ecosystem created so that some of the brilliant minds who could be expats or the diaspora from across the world wants to come back to Bangladesh. And also you get clinicians from across the globe who can practice here. So there's no need to go because we have done our study on this hospital before we chartered to signing an agreement. And December 3rd is a very auspicious and a remarkable day for us because we look at making a change in the way the healthcare delivery happens. The partnership will only succeed if we start providing that care so people can stay back here and provide the treatment. And that's the assurance we want to give. And I'd request members from the current government and other members of the August gathering to ensure such an environment and ecosystem is created so your fellow citizens from across the globe can come back here. So can many doctors who would like to practice in Chittagong come back. And I can assure you how the change happened in Dhaka in the way the healthcare spectrum is done could possibly be seen here in the coming years. 3 things which I believe will make the difference is the partnership where each one understands why this collaboration will ensure the best of care is provided. Second, technologies which can make the difference. But more importantly, the human element, which is the only reason that we looked at Dr. Rabiul Hussain and didn't look beyond. Thank you so much.
Thank you, Mr. Madhavan. Now we are requesting our guest of honor, Mr. Davison, to say few words.
Honorable Chief Guest, Honorable Special Guest, Chairman Imperial Hospitals, Chairman Apollo Group, all dignitaries and guests, my colleagues. It gives me immense joy to be here, to be present here for this historic event of the inauguration of Apollo Imperial Hospital, Chattogram. A collaboration between 2 giants of healthcare. Apollo, a pioneer and a leader of healthcare from India, and Imperial Hospitals, who is a giant in the ophthalmic care in Bangladesh, came together to create a healthcare destination in Chattogram. I wish to congratulate Dr. Professor Hussain and his board members and the entire team for creating one of the finest healthcare infrastructure here. Apollo, with its 40 years of excellence and experience, has created healthcare destinations not only in India but also abroad, with the finest of healthcare delivery processes, outcome measures, quality programs, and the customer delight. By this collaboration, we wish to bring in the 40 years of excellence in healthcare into this very facility of Apollo Imperial Hospitals and deliver the same level of care and experience which a patient will experience in any one of the Apollo hospitals. And thus, I think in the near future, the patients from Chattogram and from this country may not have to travel anymore to abroad for their most of the healthcare needs. This hospital is going to be a boon for also some of the patients of the past who had to go out of the country to get their healthcare needs and for their continued care here. I am sure this hospital will become a destination for not only the patients from Chattogram or of this country, but I am sure because of the strategic geographical location of the city and the hospital, this will become a destination, healthcare destination for patients from the neighboring countries. I am very happy to drive this initiative from Apollo and then take the complete responsibility for making this association a meaningful and a fruitful one. Once again, I wish all the best to the Apollo Imperial team. All the success for the team here. Thank you very much.
Thank you, Mr. Davison. Now we are requesting the special guest of this inauguration program, Barrister Mohibul Hassan Chaudhary, MP, to address the function.
Good afternoon. Assalamu alaikum, adab, namaskar to everyone. First of all, I'd like to thank the Imperial Hospital for inviting me here at this grand occasion. We have the Civil Society of Chittagong present here in this inauguration event. Our Honorable Minister for Land is also here. I thank our esteemed, distinguished panel of Imperial Hospital for holding this event and inviting the Civil Society of Chittagong here. This is a momentous day for Chittagong. Chittagongians have been waiting for international standard medical care for a long time. But for whatever reason, we were not having international standard medical clinical facility in Chittagong. However, with Imperial Hospital and now Apollo joining hands, we hope to have the standard of clinical care that we were all waiting for in Chittagong. We already have one GAIC accredited hospital called Evercare. We have Imperial here now, and this will be a good addition in our healthcare ecosystem in Chittagong. As we know, one institution can bring in many qualitative change in any given sector. The infusion of foreign and local talents in clinical care, in medical care, will improve the entire healthcare ecosystem. So I thank the Apollo Hospital of Chennai for this rather fruitful and constructive, and of course in the long run, which will be a beneficial and profitable venture for everyone involved. So I thank the Apollo authority as well. Personally speaking, my mother had a procedure done at the Apollo Chennai, and our representative from Apollo Chennai was just telling me that it is a venture between Apollo Chennai and Imperial Hospital. And I was taken aback by the standard of care at Apollo Chennai. I was there with my mother, who went through a particular procedure It was done successfully. The clinical standard was very high, especially the nursing care. And I often discuss this with my friends and family alike, that the nurse there, when my mother was going through her initial screening, the nurse was telling the doctor that her pulmonary function was not up to the mark, and the hospital must arrange for 2 ventilation support. So I was quite shocked that a senior nurse, was telling the surgeon what to arrange for, and the surgeon was also complying to what the nurse was telling him. And interestingly, when my mother was recovering from her surgery, she actually needed ventilation, because she was taking time to recover. Her pulmonary function was low, and exactly how the nurse predicted, the patient's recovery was exactly how the nurse predicted. So this shows that in any healthcare institution, the entire team must work in sync for the patient care, and that Apollo Chennai had. Following on that footstep, my younger brother also went there and did a procedure there, and he was also very impressed. So I'm glad to see Apollo Chennai and Imperial Hospital in Chittagong are joining hands in this great partnership. আজকের এখানে যারা উপস্থিত আছেন, যেহেতু আমাদের সবাই আমরা বাংলা ভাষা বুঝি, তো বিদেশি যারা অতিথি এসেছেন তারা এখানে এই যে পার্টনারশিপটা করছে, এটার জন্য আমরা সবাই গর্বিত চট্টগ্রামের মানুষ যে অ্যাপোলো হসপিটাল ভারতে খুব নামকরা। আমরা জানি যে এই অ্যাপোলো হাসপাতালের সাথে ইম্পেরিয়াল হাসপাতালের যেই এই চুক্তি এবং এই সমঝোতা এবং এই জয়েন্ট ব্র্যান্ডিংয়ের যেই হেলথ কেয়ার সাপোর্ট এখানে দেওয়া হবে, এটা আমরা মনে করি চট্টগ্রাম নয়, শুধু বাংলাদেশের যে সার্বিক হেলথ কেয়ার সিস্টেম, সেখানে একটা খুব গুরুত্বপূর্ণ উল্লেখযোগ্য অবদান সেখানে রাখবে। কারণ হেলথ কেয়ার এমন একটি বিষয় যে উন্নত মানের সাথে যত বেশি আমার ইন্টারাকশন হবে, যত বেশি আন্তর্জাতিক স্ট্যান্ডার্ডের সাথে আমার যত বেশি পরিচিতিটা হবে, যত বেশি আমি সেই ইকোসিস্টেমে কাজ করতে পারবো, তত আমার নিজেরও মান বৃদ্ধি হবে, আমার নিজেরও স্ট্যান্ডার্ডটা আপলিফটেড হবে। তো সুতরাং এই ইকোসিস্টেমটা চট্টগ্রামে ডেভেলপ করছে, এবং যেই কারণে করছে আমাদের মাননীয় প্রধানমন্ত্রী বঙ্গবন্ধুর কন্যা জননেত্রী শেখ হাসিনা, তার নেতৃত্বে বাংলাদেশ যে অর্থনৈতিকভাবে একটা পর্যায়ে এখন যে গিয়েছে, আমাদের মানুষের গড় আয় বৃদ্ধি পেয়েছে, গড় আয় বৃদ্ধি পাওয়ার সাথে সাথে গড় আয়ু বৃদ্ধি পাচ্ছে, লংজিভিটি এবং রিলেটিভলি যে আমাদের যে জিডিপি এবং পারচেস পাওয়ার যে বেড়েছে, এটার কারণে কিন্তু এই বিনিয়োগ এখানে সম্ভব হচ্ছে, এবং বিদেশি নানান ধরনের প্রতিষ্ঠান এখানে এই বিনিয়োগের সাথে এগিয়ে আসছেন। এই যার কারণে এই পরিবর্তন, আমরা তার জন্য প্রার্থনা করি, দোয়া করি, তিনি যেন শতায়ু হন। তিনি আমাদের মাঝে আগামীকাল আসবেন চট্টগ্রামে। চট্টগ্রামের আমাদের এখানে সবাই গণ্যমান্য ব্যক্তিবর্গ এখানে আছেন। আমরা সবার উদ্দেশ্যে বলবো, আমরা মুখিয়ে আছি আমাদের প্রধানমন্ত্রী বঙ্গবন্ধুর সুযোগ্য কন্যা, তাকে চট্টগ্রামে বরণ করে নেওয়ার জন্য। চট্টগ্রামে তিনি এই চট্টগ্রামের যে পোটেনশিয়াল, সেটা দেখে এতগুলো মেগা প্রকল্প দিয়েছেন। এখানে বিদেশি বিনিয়োগকারীরা আসবে, এখানকার মানুষের আয় আরও বাড়বে, মানুষের সক্ষমতা বাড়বে। কিন্তু যতই অর্থনৈতিকভাবে পরিবর্তন আসুক না কেন, স্বাস্থ্য এবং শিক্ষার বিষয়টিতে যদি আমাদের আন্তর্জাতিক মানে আমরা যদি রূপান্তর যাতে হতে পারি, সেটা না হলে কিন্তু ওই যে কমিউনিটিটা, এখানকার কমিউনিটিটা সেইভাবে করে গড়ে উঠবে না। এই যে স্বাস্থ্যের একটা বিশাল পরিবর্তন, বিদেশি স্ট্যান্ডার্ডের কেয়ার আমরা এখানে দিতে পারছি, আমাদের এর মাধ্যমে আমাদের দেশীয় হাসপাতাল যারা আছে, ক্লিনিক যারা আছে, তারাও উপকৃত হবে, কারণ তারাও কিন্তু অনেক ওভারওয়েলমড। এবং এই হাসপাতালে 300-র উপরে বেড আছে, টার্সিয়ারি কেয়ার খুবই উন্নত মানের দেওয়া হবে, যেগুলো আমাদের অন্যান্য হাসপাতালেও দেওয়া হচ্ছে। কিন্তু যখন ইন্টারাকশনটা হবে আমাদের অন্যান্য হাসপাতালের ডাক্তারদের সাথে, আন্তর্জাতিক পর্যায়ের মানের ডাক্তারদের এবং নার্সদের বিশেষ করে ইন্টারাকশনটা হবে, এটা আমরা সবাই উপকৃত হব। আমি আমাদের এই হাসপাতাল কর্তৃপক্ষকে অনুরোধ করব, এই হাসপাতাল যেহেতু একটা বড় এলাকায় হয়েছে, একটি নার্সিং কলেজ এবং একটি মেডিকেল কলেজ এই হাসপাতালের সাথে সংযুক্ত করে সেটা আপনারা যদি শুরু করেন তাহলে কিন্তু আমাদের দীর্ঘমেয়াদে একটা সাস্টেইনেবল টেকসই একটা পরিবর্তন এখানে আসবে, সেখানেও আমরা নিতে পারি। আরেকটি সর্বশেষ অনুরোধ থাকবে যে আমাদের দেশে কিন্তু হেলথ কেয়ার ইন্স্যুরেন্সের খুব বড় ঘাটতি আছে, এবং আমরা অ্যাপোলো চেন্নাইতে আমি দেখলাম যে সেখানকার স্থানীয় ইন্স্যুরেন্স প্রোভাইডারদের সাথে তারা অনেকগুলো প্রোডাক্ট তারা তৈরি করে সেটা তাদের পেশেন্টদের জন্য দিচ্ছে। তো এই যে হেলথ কেয়ার ইন্স্যুরেন্সের বিষয়টা খুবই গুরুত্বপূর্ণ। এর মাধ্যমে আমাদের একটা বিশাল জনগোষ্ঠী অ্যাফোর্ডেবিলিটিটা বৃদ্ধি পাবে যদি তাদেরকে আমরা ইন্স্যুরেন্স স্কিমের মাধ্যমে আনতে পারি। অ্যাপোলোর কিন্তু সেই অভিজ্ঞতাটা আছে, আমি নিজেই দেখেছি যে তারা ভারতে বড় বড় অনেকগুলো ইন্স্যুরেন্স কোম্পানির সাথে সম্মিলিতভাবে কিন্তু ইন্স্যুরেন্স প্রোডাক্টটা সেখানে অ্যাপোলো চেন্নাইতে আমি যেখানে বিল পেমেন্ট করতে গিয়ে দেখলাম আর কি যে তারা সেখানে সেগুলো দিচ্ছে। তো এই বিষয়টাও যদি আপনারা আনতে পারেন ইন্স্যুরেন্স প্রোভাইডারদের সাথে, আমার মনে হয় আমাদের সাধারণ গ্রাহকরা এখানকার রোগী যারা সমাজে অনেক জায়গা থেকে এখানে আসে, ফেনী থেকে আসে, কক্সবাজার থেকে আসে, অনেক জায়গা থেকেই চট্টগ্রামে চিকিৎসার জন্য আসে, তারা সবাই উপকৃত হবে বলে আমি মনে করি। আমি এই কথা বলেই আজকের উপস্থিত সবাইকে আবারও শুভেচ্ছা জানিয়ে আমি আমার বক্তব্য শেষ করছি। সবাইকে ধন্যবাদ। জয় বাংলা, জয় বঙ্গবন্ধু।
Thanks to sir. Now we are requesting the chief guest of this function, Mr. Saifuzzaman Chaudhary MP, to give his valuable speech.
Bismillah ar-Rahman ar-Rahim. Mr. President, special guest in the dais, Honorable Deputy Minister of Education, distinguished guest, ladies and gentlemen, members of the media, very good afternoon to all of you. It's indeed a great pleasure and honor for me to be invited in this event. It's certainly quite a remarkable event for the Imperial Hospital and for the city of Chittagong as a whole. The joint venture event between Apollo Hospital and the Imperial Hospital. Apollo has become one of the strong name in the healthcare sector, as we all know. Their presence will certainly create momentum in this sector, and I feel really good that the management of Imperial Hospital has taken the right decision about going for a JV. This is my second time in this hospital, and first time I was here probably 12 years ago. Mr. Malek has invited me during this construction period. Anyway, honestly speaking, I don't call this hospital. This is not a hospital actually. I'm sorry, I don't like to disappoint you, those who are sitting here, but I'd like to rather make you feel happy. This is a resort type 5-star hospital, I would say. The moment you step into this hospital, you feel good. Especially 12 years ago when I came, I remember about this dome. Look at that. Such a nice way of done this thing. And I had a feeling that once it's completed, this dome, this area will be a very significant one. And I feel really good sitting in this dome and giving a speech, and it's really nice ambience, I would say. And look at this, it's a very nice area. I mean, you feel good, it makes you feel good. But everything looks okay. But when it comes to diagnosis, when it comes to service, I think I'm quite lacking on that. I'm sure with this new joint venture, with the experience of Apollo Hospital, you will be able to make a significant change in this area. Because what we have seen, it's rather unprecedented. Who has ever thought that we'll be seeing a pandemic of this magnitude, the COVID-2019, in our lifetime? It's such an experience. It's a rather horrible experience, I would say. So many of us lost our loved one and dear one. We never thought that there will be a tsunami like this. But as far as Bangladesh is concerned, handling this COVID, I must give a thank to our Honorable Prime Minister Sheikh Hasina for handling this pandemic in a very, very smart way. If you look at the fatality compared to the rest of the world, I think it's very, very, very low because of our advanced precautionary measure. Having said that, I would like to thank Imperial Hospital, the way they have handled the COVID patient during this pandemic and when the outbreak happened. Those who were living in Chittagong, they were basically helpless. Where to go, how to get a treatment, how to save their lives. And thank God, Imperial probably opened their operation more or less during that time, if I'm not wrong. And they have taken a very good precaution, and they have been able to take care of a lot of the patients during those times. Since this hospital is in Chittagong and is one of the important hospital to me, I had been keeping a very close eyes in the day-to-day operation of this hospital, through in many ways. I don't know whether the management has ever realized that, but I have never made them feel that I've been watching the overall activities of this hospital. For some reason, your handling of COVID patient was definitely a remarkable one, but unfortunately, post-COVID situation, I think for some reason, you are not performing the way you had been performing. Let's put it that way. I think the decision which you have made, I would say that it's the right decision. Joint venturing with multinational companies, especially the strong name in the health sector like Apollo Hospital. I'm sure with their expertise, with their experience, this hospital will certainly be able to cater the patients of Chittagong. The gentleman who was sitting next to me is the Chennai, I'm sorry, Mr. He was telling me their Apollo, this is like 40 years of their experience in this health sector. They have shifted their focus a bit differently now. How is it? He was saying to me, now we are focusing how to keep people away from hospital. They don't want people to come to hospital. So like what? All this precautionary measure, how to, to change the lifestyle. Now the diabetic, the renal problem, other things became a very common phenomenon. So how to change this? Obviously, the lifestyle, the food habit. This is what we need to change. We just keep on, we keep on running to the hospital, to the doctor, every time we feel bad. আজকাল তো আমাদের এমন অবস্থা হয়, একটু কাশি হলে ডাক্তারের কাছে দৌড়ায়। আমাদের অনেক সময় কাশি টাশি হয়, কিন্তু আমরা ওই হয় নিজের বুদ্ধি বিবেচনা করে কিছু ওষুধ খেয়ে নিলাম, বা নেহায়েত বেশি কনজেশন হলে ডাক্তারের কাছে একটু ফোন করি। কিন্তু এখন একটা ফ্যাশনও হয়ে গেছে, মনে করেন মালিক সাহেবরা আছে এখানে, মাহবুব সাহেবরা, অনেক বড় বড় লোকরা আছে, কিছু হলে সিঙ্গাপুর দৌড়াই। আরে ভাই, আমরা তো সিঙ্গাপুর দৌড়ে যেতে পারবো না, উই ক্যান অ্যাফোর্ড। ব্যাংকক সিঙ্গাপুর আমরা পারবো না বলে যেতাম। মালিক সাহেবের মতো লোক রাতে ফোন করলে চিন্তা করলো যে আমার পেট ব্যথা করতেছে, সকালে আমি সিঙ্গাপুর দৌড়াবো। এখন আমি তো পারবো না, চিটাগাংয়ের আরো লোক আছে, ওনারা তো পারবে না। পেট ব্যথা হইলো সকালে দৌড়াইলাম সিঙ্গাপুরে, বা রাতের ফ্লাইট কি আছে দেখো, এসকিউ ধরো, এসকিউ তাড়াতাড়ি ধরো, রাতের 12টা, রাতের 9টার ফ্লাইট চিটাং থেকে গেলে 10 টাকার কানেকশন হয়ে সিঙ্গাপুর চলে গেলাম সকালবেলা। ডক্টর মইনুল সালাম সাহেব এখানে আছে, মা ওনার পাট করে দৌড়ে যেতে পারবো। এখন আমাদের মতো সাধারণ লোকদের জন্য ভেরি ডিফিকাল্ট। উই নিড এ সার্ভিস ইন দিস সিটি, ইন দিস হসপিটাল। আপনারা গেলেন, আমাদের কি হবে? আমরা তো আর দৌড়াইতে পারবো না, তো আমাদের এখানেই থাকতে হবে। আমাদের চিকিৎসা দরকার। উই নিড এ গুড সার্ভিস, উই নিড এ গুড ডক্টর। এখন ওই কিছু কিছু নিজেকে সেন্স অ্যাপ্লাই করতে হবে আসলে, না হলে ভেরি ডিফিকাল্ট। আমাদের একটা বদভ্যাস, সর্দি কাশি হলে আমরা হসপিটালে দৌড়াই খালি। আরে কাম অন, আপনার বুঝতে হবে সিজন চেঞ্জ, ট্রানজিশন টাইম। ওকে কি খেলে কি হতে পারে, আচ্ছা একটা প্যারাসিটামল খেলাম বা টায়ানল খেলাম, বা এটা হতে পারে, ওটা বা নিজে একটু কেয়ারফুল হওয়া, এই জিনিসগুলো কিন্তু উই হ্যাভ টু স্টার্ট প্র্যাকটিসিং, না হলে কিন্তু উড বি ভেরি ডিফিকাল্ট। ঘন ঘন সবাই মাইন্ড ইট, দিস ইজ বাংলাদেশ বিং এ ভেরি overpopulated country. এখানে enough hospital নাই to cater all these people. এখানে এত প্রেশার হয় অনেক সময়, ইভেন ঢাকায়ও বড় বড় হসপিটালগুলোতে এত বেশি প্রেশার হয়, দে ক্যানট কোপ আপ। তো কোপ আপ না হলে সার্ভিস ব্রেকডাউন করে, ডিফিকাল্ট হয়ে যায় অনেক সময়। বেড দিতে পারে না, সিট খালি থাকে না, ডাক্তার একটা ডাক্তারের আন্ডারে 500টা পেশেন্ট, ভেরি ডিফিকাল্ট। তো সুতরাং আমাদেরকেও নিজেদেরকেও কিন্তু কিছু চিন্তা ভাবনা করতে হবে। যাই হোক, আমার মনে হচ্ছে I think and the Imperial is heading towards the right direction, and obviously as a Chittagonian, obviously I will extend my all-out support, which I had been doing, but I don't mind to do it further, provided if you come clean. How it cleans? You have to be proactive. You have to be committed. Especially the management has to be very committed. They must know what they are doing. Absolute delegation of power is very important. It has to be a corporate structure. One man show cannot run this sort of infrastructure. You have to infuse a very, very professional corporate professionalism structure. Otherwise, it's very difficult. This has become a public property now. I know you have invested, but this, once established, this sort of institution becomes a public facilities, public asset, because common people's involvement are here. So you have to think in that way. So Sutarang, among this, me and you will at some point have to leave this world. But this institution will remain forever, as long as we can make it to remain forever. This is very important. আমরা আমাদের সরকার আমলে আমরা কিন্তু কমিউনিটি হেলথ আমাদের মাননীয় প্রধানমন্ত্রী কিন্তু করেছিল when she came to power first time back in 1990s. আমাদের এখানে সুশীল সমাজের লোক আছে, আমি কিছু কথা বলা দরকার আছে। উনি চিন্তা করলো গ্রামে গঞ্জে কমিউনিটি ক্লিনিক আমি চালু করব, And that was really running well. It clicked. Community clinic corridor. তারপর কি হলো 2001-এর সো-কল ইঞ্জিনিয়ারিং ইলেকশনের মাধ্যমে আওয়ামী লীগকে হারানো হয়েছিল। 2001 সালে বিএনপি জামাত ক্ষমতায় আসেন। এসে প্রথমেই বেগম খালেদা জিয়া কমিউনিটি ক্লিনিক বন্ধ করে দেয়। দেখেন পলিটিসাইজ কিভাবে হয়। ওয়াই? এটা তো দেশের স্বার্থ কাছে, প্রধানমন্ত্রী শেখ হাসিনা নিজের স্বার্থের জন্য করে নাই, দেশের মানুষের জন্য করছিল। না, কোনো কমিউনিটি ক্লিনিক আর কিছু করা হবে না। 5 বছর ইট ওয়াজ রাদার শেলফ। কি হলো? পিপল সাফার। শেখ হাসিনার কিছু হয় নাই, বাট আলটিমেটলি সাধারণ জনগণের ক্ষতি হয়েছে। এনিওয়ে 2009 সালে আমরা যখন আবার সরকার গঠন করি, that plan had resumed. উনি কমিউনিটি ক্লিনিক চালু করলো এবং এই লাস্ট 14 years কমিউনিটি ক্লিনিক কিন্তু ডুইং ভেরি ওয়েল। আমরা শুধু কমিউনিটি ক্লিনিক না, আমরা হেলথ সেক্টরেও অনেক কাজ আমরা করছি। আমরা এই কোভিড সিচুয়েশনে আমরা বাংলাদেশের সকল নাগরিককে ফ্রি ভ্যাকসিনেশন দিয়েছি। খুব পৃথিবীর কম দেশ যেখানে, পৃথিবীর সব দেশ কিন্তু এখানে আর্গুমেন্ট করছে যে অনেক বড় দেশও দিয়েছে, সবাই দেয় না পৃথিবীর। অনেক দেশে কিন্তু টাকা দিয়েও কিনতে হয়েছে, কিন্তু বাংলাদেশ ওয়াজ অ্যান এক্সেপশন। আমাদের মতো দেশে এই যে $1 বিলিয়ন ইনভেস্ট করা ফ্রি কোভিডে, ইউ শুড রেদার অ্যাপ্রিশিয়েট দ্যাট। এটাকে অ্যাপ্রিশিয়েট করতে হবে কিন্তু আমরা রাইট টাইমে, এক্সকিউজ মি, আমরা রাইট টাইমে ফোরকাস্ট করতে পেরেছি। যদি মনে করেন প্রাইম মিনিস্টার, আমাদের প্রধানমন্ত্রী যদি ওটাকে এত বেশি সিরিয়াসলি না নিত, তাহলে কি হতো? এমন একটা সময় গেছিল ভ্যাকসিনে পাওয়া যাচ্ছিল না, হাহাকার হয়ে গেছিল। আমার এখনো মনে আছে ওই সময় ইভেন ইন্টারন্যাশনাল অর্গানাইজেশন ফোরকাস্ট করেছিল এই কোভিডে বাংলাদেশে বহু মানুষ রাস্তাঘাটে মরে পড়ে থাকবে। ফ্যাটালিটি উড বি so high, it will be absolute disaster. হয়েছে আলহামদুলিল্লাহ। ফ্যাটালিটি যদি দেখেন, আমি একটু আগে বলেছি ভেরি 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 লো। তো আমরা এটা we had been able to manage that thing. I don't like this point, but look at what happened to Delhi. People just died over there. তো আমরা আল্লাহর রহমতে এখান থেকে আমরা বেঁচেছি। দেশ গত 14 বছরে আমরা কিন্তু ধাপে 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 একটা ডিফারেন্ট হাইটে চলে এসেছি। Look at the size of the economy of Bangladesh. It's quite big. Growth was tremendous. For the last 14 years, the GDP growth, if you look at, it's between 6 to 7%. আজকাল রিজার্ভের কথা চায়ের দোকানে বলে, এই হয়ে গেছে রিজার্ভ, ওই হয়ে গেছে। চায়ের দোকানে রিক্সাওয়ালা রিজার্ভের কথা বলে, এখন কি বুঝে বলে না বুঝে বলে, I don't know. What are the international standard of the reserve? 3 months. আপনার imported 3 months. যদি আপনি রাখতে পারেন এসেনশিয়ালের জন্য, you are safe. This is the international standard. আর আমার যে রিজার্ভ আছে, আমার একদম, আমি এই ক্যালকুলেশন ওই ক্যালকুলেশন নেট রিজার্ভ যে 4 months, আমার নন এসেনশিয়াল আইটেমের উপর এলসি কমানো হচ্ছে, এসেনশিয়াল আইটেমের এলসি বাড়ানো হচ্ছে, বাট আমার গ্যাপটাকে যেটা বড় ছিল এটাকে ক্লোজ করা হচ্ছে। সো ক্যালকুলেট যদি করে ইম্পোর্ট অ্যান্ড এক্সপোর্ট, আমার 4 months উপরে রিজার্ভ আছে, হুইচ ইজ গুড। আমি যদি আরো আমাদের ইকোনমিস্ট আছেন উনি, রিজার্ভটা কেন রাখা হয়? রিজার্ভটা রাখা হয় ইমার্জেন্সির জন্য। ইমার্জেন্সি বুঝাতে কি মেইনলি? ইমার্জেন্সি মানে লাক্সারি জিনিস না। ইমার্জেন্সি বোঝা, মনে করেন আমার এখন খাদ্য আমদানি, মেইনলি আমার চাউল আমদানি করার জন্য, আমার ইন্ডাস্ট্রিয়াল র মেটেরিয়ালের যাতে সাপোর্ট দেওয়ার জন্য, বেসিক যে সমস্ত এগুলোকে যাতে আমি চালাই নিয়ে যেতে পারি। যেটা শ্রীলঙ্কা হয়েছে, রিজার্ভ খালি হয়ে গেছে, চাউল আমদানি করতে পারতেছে না। আমার দেশে কিন্তু এটা না, আমার রিজার্ভ পুরো আরেকটা বাফার স্টক আমি রেখেছি। আমার চাউল বাফার স্টক হিসেবে আছে, অর্থাৎ আমার যে পরিমাণ স্টক আমরা রেখেছি কিছু রেইনি ডেজের জন্য, এটাকেও কিন্তু আপনি ক্যালকুলেশন আনতে হবে। অর্থাৎ আমার এটার জন্য আমাকে কিন্তু বেশি করতে হবে না, চাউল আমদানি বেশি করতে হবে না, আমার নিজস্ব স্টক আছে। তাহলে আমার ওই পরিমাণ, আমার তো বাফার স্টকও আছে কিছু, তাহলে ওই পরিমাণ আমার ইম্পোর্ট করতে হবে না। তাহলে এই টাকাটা আমার জন্য আরেকটু বেটার ওয়েতে যাবে। হ্যাঁ, কিছু কিছু জায়গায় আমাদের সমস্যা হচ্ছে, বুঝতে হবে ইকোনমি সাইজটা অনেক বড় হয়ে গেছে, টু ফাস্ট, একটু বেশি কুইক, বেশি বড় করে দেওয়া হয়েছে, যার কারণে আমাদের একটু হিকাপসগুলো হচ্ছে। হয়তো আমরা কোভিডকালীন বাজেটটা এত বেশি বড় না করতেও পারতাম, বাট এনিওয়ে দ্যাটস আ ডিফারেন্ট ইস্যু, আই ডোন্ট ওয়ান্ট টু ডিসকাস হিয়ার। তো কিছু কিছু ইস্যু আছে যেখানে হচ্ছে, বাট ফেসবুক সোশ্যাল মিডিয়াতে যে সমস্ত কথা বলছে, ব্যাংকের টাকা উধাও হয়ে যাচ্ছে, ব্যাংক থেকে টাকা উইথড্র করা হচ্ছে, এটা হচ্ছে, দিস ইজ নট গুড। এটা ভালো না, জিনিসটা ভালো না, আসলে এটা খারাপ, এটা দেশে ক্ষতি করা হচ্ছে, এটা একটা অ্যাবসলিউট ফলস প্রপাগান্ডা। এই যে মানুষকে প্রভোগ করে এটা করাটা ঠিক না। আমি তাদের উদ্দেশ্যে প্রশ্ন করতে চাই, এবং এখানে কিছু কিছু ঢাকায় বসে ডক্টর আসিফ নজরুল খুব লম্বা লম্বা লেকচার বলে, বোকা আমরা, গাধা। সে দেখা যাচ্ছে সে নিউট্রাল পার্সন, সে আরেকজনের এজেন্ডা বাস্তবায়ন করছে। কিসে নিউট্রাল দেখাচ্ছে? সে সব জানতা না, সে সব কিছু বুঝে, আর আমরা এখানে সব গাধা গোড়া ঘুরছি না। আমরা বুঝতেছি না সে কোন দলের লোক, সে কি কথা বলতে চাচ্ছে। কথা তো বলো খুব সুন্দর সুন্দর, নির্বাচন নিয়ে কথা, অবৈধ সরকার। কিসের অবৈধ সরকার? কাকে অবৈধ সরকার? সে নির্বাচনে যদি কেউ আসতে না চায়, সেখানে আমাদের কোনো কিছু করার নাই। অবৈধ সরকারের লেকচার দেশে, কিসের অবৈধ? মুখে যা আসে তা বলে, মনে হচ্ছে হি ইজ দি কিং অফ দিস কান্ট্রি, সে অনেক কিছু বুঝে। বাংলাদেশে মনে হয় খুব স্মুথ চলছিল 75-এর পরে, একবারে কোনো সমস্যা ছিল না, বেশি পেয়ে গেছে, এখন কি বেশি মাথার উপর উঠে গেছে, নিজেকে অনেক বেশি মনে করছে না? আই এম সরি, আমার এগুলো বলতে হচ্ছে, নিজেকে এত জাহির করা ঠিক না। দেশ চলছে, হ্যাঁ, একটা বড় দেশ চলতে গেলে একটু সমস্যা হয়, সব কিছু হয়তো রাইট ওয়েতে মানুষের এক্সপেকটেশন অনুযায়ী হয় না, বাট যাদের কথা বলছে তাদের শাসনামল আমরা দেখেছি, তাদের শাসনামলে কি হয়েছে সেটা মানুষ আমার মনে হয় না ভুলেছে। সুতরাং আমরা তাদের সাথে কম্পেয়ার করলে উই আর বেটার অফ। দেশ অনেক ভালো আছে, অস্থিতিশীল করে কোনো লাভ হবে না। ফেসবুক, ইনস্টাগ্রাম, এই যে সোশ্যাল মিডিয়াগুলোতে যেভাবে সমস্যা হচ্ছে, এটা আর একটা সমস্যা। এখন সবাই সাংবাদিক হয়ে গেছে, হাতে আপনার তো মিডিয়া, আপনার তো ডিভাইস আপনার হাতে চলে আসছে। আপনি এখন একটা পোস্ট করে দিলেন, বুঝেন না বুঝেন কথা তো বলে দিলেন, লন্ডনে বসে, প্যারিসে বসে, আমেরিকায় বসে খুব দিব্যানামে কথা বলছে, যা ফ্রি স্টাইল। ওই যে একটা কথা বলে, আমরা সবাই রাজার রাজার রাজত্বে। ঘটনাটা এটাই হয়ে গেছে, আপনার ডিভাইস আপনার হাতে চলে আসছে, ইউ গট দ্য লাইসেন্স, আপনি এখন পোস্ট দিয়ে দিলেন, আপনার আপলোড করে পোস্ট দিয়ে দিলেন, ইচ্ছা মতো কথা বললেন, বুঝে বলেন না বুঝে বলেন, চলছে, ভাইরাল হয়ে যাচ্ছে, মিলিয়ন্স অফ ফলোয়ার্স আপনার কাছে, বুঝে না বুঝে। এগুলি করে কোনো লাভ হবে না। সমাবেশ করব পল্টনের ময়দানেই করতে হবে, সরারদিতে তো যদি এতই সাহস থাকে সরারদিতে করে দেখান। পল্টন তো একটা রাস্তা, সড়কে পল্টনের রাস্তায় তো ইয়ে করে তো লাভ নাই, নয়া পল্টনে সরারদিতে করে দেখান। আবার অ্যানালাইসিস করছে, সাধারণ মানুষ সম্পৃক্ততা এসেছে কিভাবে, কই আমাদের অ্যানালিসিস তো আমরা দেখছি না। সাধারণ মানুষ এখনো সম্পৃক্ত হয়নি তাদের আন্দোলন সংগ্রামে। তাদের দলীয় নেতৃবৃন্দ বিভিন্ন বাংলাদেশের বিভিন্ন জায়গা থেকে এসে যেখানে অনুষ্ঠান হচ্ছে ওখানে গ্যাদারিং করছে। নাহলে তারা তো কমপ্লেন করছে কেন, গাড়ি বন্ধ করে দিচ্ছে, এটা বন্ধ করে দিচ্ছে, এই কমপ্লেনগুলো কেন করছে? কারণ তাদের নেতাকর্মী বরিশাল যদি হয়, ঢাকা, সিলেট বিভিন্ন জায়গায় যেতে হয়, সেই জন্য যেতে পারতেছে না। সেই জন্য তো সাধারণ মানুষ সম্পৃক্ত হয়েছে কিভাবে বুঝলাম আমরা। সাধারণ মানুষ সম্পৃক্ত কেন হবে, কি কারণে হবে? সাধারণ মানুষ কি অশান্তিতে আছে? তারা এসে কি, তাদেরকে বলতে বলেন, তারা এসে কি করবে? লন্ডনে বসে দেশ চালাবে? Is he that competent to run this country? What knowledge, experience does he have? কি এত সোজা? IMF আসলো, কি বললো? বলছে ইটস ওকে, থিংস আর ওকে, খারাপ তো বলে নাই। তো সুতরাং এইগুলো বলে লাভ নেই। দেশ চলছে। আমি আপনাদেরকে অনুরোধ করব, একেবারে ফালতু কথায় কান দিয়েন না। এভরিথিং ইজ ওকে। অস্তিত্ব তারাই খারাপটা করতে চাচ্ছে, তারা নানা রকম ফলস প্রপাগান্ডা দিয়ে। আই ডোন্ট থিঙ্ক ইটস গোনা ওয়ার্ক ইনশাআল্লাহ। কান্ট্রি ইজ ইন দ্য সেফ হ্যান্ড। আমি বারবার একটা কথা বলি, মাননীয় প্রধানমন্ত্রী জননেত্রী শেখ হাসিনার হাতে যদি দেশ নিরাপদ না থাকে, দেশ কারো হাতে নিরাপদ না। অ্যাজ সিম্পল ইজ দ্যাট। এনিওয়ে, একটু পলিটিক্যাল বক্তব্য। আমি মালিক সাহেবকে বলি, আমরা যদি রাজনীতি করি, দেশের মন্ত্রী, একটু আপনাদের প্রেস করলো, দেশ দুনিয়া সম্পর্কে তো কিছু বলতে হবে, নাহলে কেমনি হবে? এনিওয়ে, আই উইশ অল দি বেস্ট to this new joint venture between Imperial and Apollo, and I look forward to see their remarkable achievement. Long live our friendship. অসংখ্য ধন্যবাদ। ভালো থাকুন, সুস্থ থাকুন, নিরাপদে থাকুন। জয় বাংলা, জয় বঙ্গবন্ধু, বাংলাদেশ যুবক। এবং আমি এটার ইনগ্রেশন উদ্বোধন ঘোষণা করছি। ওকে, আই ডোন্ট নো, ইউ টেল মি। বলেন কোথায় কি করতে হবে? হ্যাঁ, I now declare the official opening of this new joint venture between Apollo and Imperial Hospital.
Dear audience, we are almost at the end of the program. We are thanking all of our distinguished guests and audience to join in this program in spite of their very busy schedule. We are now requesting the Managing Director of IHL Board, Mr. Mohammad Amjadul Firdaus Chaudhry, to present memento to our distinguished guests. We request Mr. Wahid Malik to receive the memento on behalf of Barrister Mohibul Hassan Chaudhary, MP. We also request Sir to present the memento to the founder and chairman of Apollo Hospital Limited, Dr. Pratap C. Reddy. We request Dr. Dinesh Madhavan to receive on behalf of Dr. Pratap C. Reddy.
Thank you. Now we request the chairman of this function, Mr. M.A. Malek, recipient of Ekushi Podok 2022, to propose a formal vote of thanks.
Service to humanity is the price we must pay for this space we occupy on this earth. মানুষের সেবার জন্য আমরা যারা একটু সৌভাগ্যবান তাদের হাত প্রসারিত করাই এবং অন্যদেরকে উৎসাহিত করাই আমাদের মূল কাজ। আর এই বিজয়ের মাসে আমি স্মরণ করি সেই সব মুক্তিযোদ্ধাদের যারা তাদের বুকের রক্ত দিয়ে আজকে আমাদেরকে এখানে দাঁড়াবার সুযোগ করে দিয়েছে। আপনারা যারা এখানে বসে আছেন, আমরা স্বাধীন বাংলাদেশের নাগরিক হিসাবে এখানে বসতে পেরেছি তাদের বুকের রক্তের বিনিময়ে। ওই তাদেরকেও সেলিউট জানাই। Today, our chief guest, Minister Saifujaman Javed, our special guest, Barrister Mohibul Hassan Chaudhary, who left for his earlier, he was an engagement, but still he gave us the time, spare some time for here, because you know tomorrow our Prime Minister will be here, and he was entrusted to his definite job to arrangement for her reception and for the meeting. And our guest of honor, Mr. Dinesh Madhavan, President Group Oncology and International, Mr. Davison PKCO, Partner Hospitals. I have been entrusted with a pleasant task of thanking you to witness the handover and takeover of Imperial Hospital by the Apollo Healthcare International Division, Chennai. There are 70 international outlets in Africa and Europe. Here I like to mention that the names of BNSB, Bangladesh National Society for Blind, as they are our parent body. We had some funds, so visionary Dr. Rabiul Hussain, managing trustee, suggested to establish a most modern hospital in Chittagong, as we have land adjacent to BNSB, and which you can see here. So we board of directors embarked upon with the project. Today you see the most modern Imperial hospital with 380 beds. We have all the modern machines, facilities. After when Mr. Visited our project, he said, and it is true, that we are much more well equipped than the Singapore hospital, Mount Elizabeth, because their machines are a bit older than what we have today in our hospital. But all of you know that when we entered into an agreement with the Apollo Hospital, we need some specialist doctors from India and abroad. But you know the red tapeism in Bangladesh or any other country. So we had to struggle for the permission to bring some specialist doctors from India and other countries with the help of Apollos. We, the team from Chittagong, consisting of Dr. Rabiul Hussain and Mr. Ferdows, our MD, we went to Chennai for this agreement signing, where I met the brainchild of Apollo Hospital, Dr. Reddy, who is only a young man of 92 years. After seeing him, his energy and everything, I also I was inspired by his service capacity and everything what he has done. He has done a wonderful job of establishing 70 outlets in Asia and Africa. He's a man giving the service. He earned so much of money. I saw him, he's driving a Rolls Royce in Chennai. And whenever he goes to his establishment, he takes this private jet to fly and see the establishment, whether it is running efficiently or not. So still, he's a young, energetic man who inspires all, including me and all who follows him in his institution. Last but not the least, we, the Imperial Hospital, indebted to the lion-hearted man who devoted all his life for the betterment of Chittagong, is Mr. Akhtaruzzaman Babu, the father of our chief guest. When I asked him to see our hospital, he came over here for finance. At that time when he visited this hospital and everything, all the structure has been done, he landed here in the front. He said that when people comes to us for bank helps, for loan, they shows us the ground which has been taken or given some money and just a paper. But you have already established a structure and everything has been done. So, and for the sake of Chittagong, he said that we are ready and we will be financing from United Commercial Bank. We are really grateful to United Commercial Bank and all of their directors, because today we are here. We will not be here without the help of United Commercial Bank. They form a consortium with World Bank and other banks to finance. So we are really indebted to them. And Chittagong, earlier I said that we have everything, all the machines and equipments, but we had no specialist doctors, for which we have joined hand with the Apollo Chennai. And today we are launching, official launching of Apollo Imperial Hospital. And last but not the least, I must thank all of you who are sitting in front of me, because from the beginning it is about 2.5 hours. You took the time making to be here because you love Imperial Hospital and you want to have a specialized hospital which you will be needed, may be needed in future, because we are always a patient. But there is one thing, one saying, that prevention is better than cure. So Apollo has changed their course. Now they have gone for other course and they are trying to keep it because they have got so much of passion. They want to be, they want that the passion should not be that much which they cannot handle. So you'll have to build your reputation first. People will come and you will have to give the service. Service is the most important thing which the people want. And last but not the least, another thing I want to say that we are really grateful to our doctors, nurses, and our hospital workers, those who are here to give services, to provide services for the patients. We have got a wonderful building and everything, but without service, nothing happens, and people will not come to us. Because where there is a service, people will go there. Because people always, I myself, one thing I want to mention here, that I am also grateful to the doctors and the surgeons, because I have got 5 bypasses, open heart surgery, and I don't have any gallbladder or hernia. So I am a reconditioned man myself. And all this praises goes to the surgeons and doctors, for whose, and with the help of Almighty, I am still here and speaking before you. Otherwise, I do not know where I would have been. I must thank our chief guest, Mr. Saifuddin Chaudhary MP, and Mr. Barrister Mohibul Hassan Chaudhary MP, who left for his preoccupation, and guest of honor, Mr. Dennis Madhavan, President Group Oncology and International, Mr. Davison, PKCO, Partner Hospital. And our guest from India, Mr. Rana Dasgupta, CEO, Eastern Region, Mr. Abhijit Mojumdar, CEO, Apollo Multiple Hospitals, Kolkata, and Mr. Subramaniam, Healthcare Consultant, Curis, Mr. Benazir Badruddin Sharif, General Manager, Lifeline Multi-Speciality Hospitals. And I must thank Mr. Rajiv Ranjan, Assistant High Commissioner of India, who is with us here. We are really grateful to you for coming. And Mr. Abul Momen, journalist, writer, and columnist. Mr. Mahbul Alam, President, Chittagong Chamber of Commerce. Mr. Munir, Country Director, Orbis. And we have some educationists with us, which we regard them very much. Mr. Alamgir Muhammad Sirajuddin, Mr. Shakandar Khan. Thanks to Mr. Dr. Pradeep Reddy, Chairman, Apollo Hospital Group, and Preeta Reddy, Executive Vice Chairperson. Now I'd like to introduce our directors of Apollo Imperial Hospital. Our MD, Mr. Amjadul Ferdos Chaudhary. Ek minute. Acha. And Mr. Muhammad Nurul Amin, Mr. Jahangir Alam Khan, Mr. Salim Ahmad, Mr. Ariful Karim, Mr. Nafid Nabi, and Mr. Shakawat Hussain, FCA. I thank you all for your patient hearing. Joy Bangla, Joy Bangabandhu, এবং আমি আসলে আমি বাংলাদেশ চিরজীবী হোক সে কথা কখনো বলি না, কারণ তাহলে সেখানে একটা সন্দেহের অবকাশ থাকে। আমি বলি যুগ যুগ জিও। জি, সেটা আমরা দেখবো ইনশাল্লাহ। আপনি যখন বলেছেন উইল ট্রাই টু ডু সামথিং। আপনারা এতক্ষণ ধরে যে ধৈর্য সহকারে আমার বক্তব্য শুনেছেন সেই জন্য আপনাদের কাছে আমরা কৃতজ্ঞ। কারণ আপনারা যারা আজকে অডিয়েন্সের মধ্যে যারা আছেন, আপনারা যদি না আসতেন তাহলে আমাদের এই যে অনুষ্ঠান সেটা মোটেই সার্থক হতো না। আপনারা আসাতে সেটা সার্থক হয়েছে, সেই জন্য আমরা আপনাদের কাছে কৃতজ্ঞ। আপনারা সব ভালো থাকুন, সুস্থ থাকুন, এই কামনা করে আমি আমার বক্তব্য এখানে শেষ করছি। খুদা হাফেজ। ধন্যবাদ আপনাদের সকলকে, ধন্যবাদ।
Thank you, sir. We are cordially inviting our guests to kindly proceed to multipurpose building for lunch, cafeteria, ground floor. Our doctors and staffs are requested to sit for lunch, second batch, after our guests.
For the journalists, we have made separate arrangements in the auditorium of first floor of multipurpose building, where in the leaderships of Apollo hospitals, we like to interact with journalists. We wish you very best, prosperous and healthy life. Thank you.